The epicenter of the outbreak is said to be at a place called Usingo area in neighbouring Somalia. The disease is said to have spread alarmingly into Kenya due to the pastoral nature of the communities living in the area and the porosity of the Kenya-Somalia border, where there is no restricted movement of the infected in and out of Kenya. The Kenya Red Cross immediately swung into action to save lives once the outbreak was reported. But already the deadly disease had claimed the lives of 35 people, among them 10 Kenyans and 25 from the neighbouring Somalia.
The transmission came through another village which is 18 kilometers from the border called Warak. And then because of the pastoral nature of the communities moved in to the Kenyan side through Amuma and then to Hamey, and then finally others reached as far as Damajaley.
According to the Kenya Red Cross officials, the most affected towns include Amuma, Damajaley and Hamey, where the greatest number of casualties have been reported. Emergency treatment centers have already been established in 3 locations, and so far more than 117 patients have been diagnosed with the disease, treated and some discharged.
And at times some of them come with while they're in shock, but luckily they access the camp and we rehydrate them with IV fluids and oral rehydration salts. Luckily right now the situation is okay, and we are expecting more. Already like 4 people have been reported to have died before reaching the place. And because of hot weather, normally they can't make to this place during the day.
The Kenya Red Cross has also embarked on a mission to distribute treated water and offer medical care to local communities to curb further spread of the disease.
The Kenya Red Cross is carrying out in 4 dimensions treatment of cholera cases that have been received at the cholera treatment centers that we've set in the 3 areas, that is Amuma, Hamey here, and Damajaley. The other services that we are giving is active case finding and follow-up of the cases we receive, to give a prophylaxis to the household members and try to see if there are other cases that remained behind in the households.
Daniel Lagat, the regional health officer, says so far the situation has been contained on the Kenyan side, though fears still remain on how to contain the situation on the Somalian side, where the outbreak started.
The Honorable Justice Luka Kiprotich Kimaru, the Honorable Justice Mohammed Abdullahi Wasame, Lady Justice Wanjiru Karanja, the Honorable Mr. Justice Joseph Raphael Karanja, the Honorable Lady Justice Helen Amuma.